this is a topic that a lot of people are interested in, and I'm glad to see so many people here. Just really briefly about myself. I'm an assistant professor of medicine at Cooper Medical School of Rowan University. I'm an internist by training. I did my internal medicine residency at CMSRU, and I also did a fellowship in palliative medicine at CMSRU with a heavy emphasis on learning how to help to take care of cancer patients. Um, I have three board certifications. I'm board certified in internal medicine, in palliative medicine, and I'm also a board certified hospice medical director. I've been practicing at MD Anderson Cooper for about 7 years now, and my primary focus is on symptom management for cancer patients. What I for anybody that hasn't met me before, what I usually tell my patients about palliative medicine is that oncologists focus on dealing with the cancer, and my focus is on trying to help people feel better while they're dealing with that. So that's just about me. I'm going to move on to my second slide. So there's the title. The topic is treatment, or more specifically, chemotherapy-induced peripheral neuropathy. There we go. Okay. So this is what we're going to be talking about for the next hour. These are just common questions that that people with cancer and cancer survivors will ask about peripheral neuropathy. So what is it, and what causes it? What are the symptoms? So how do you know if what you're experiencing is peripheral neuropathy? And if that is what you're experiencing, how long are those symptoms going to last? What can cancer survivors do to relieve their peripheral neuropathy, and what can they do if they're experiencing that to protect themselves from injury? That's an important thing to consider. And then what other advice can we give to cancer survivors who are experiencing neuropathy? So these are just some statistics on how common neuropathy is. So among the general population, about 5 to 10% of people actually experience neuropathy. Diabetes is the #1 cause in the United States of peripheral neuropathy, and that's about half of people with diabetes will experience neuropathy. And having diabetes is also a risk factor. It can put you at increased risk of getting neuropathy if you're getting cancer treatment.
Yeah. I
There's
forgot that you emailed me. I thought you were going to text me, so I messed up.
I think there's a microphone that's on. If that could be muted, please, that would be great.
I muted it, Doctor.
Thank you so much. So other causes of neuropathy: heavy alcohol use, nutritional problems, thyroid problems, rheumatoid arthritis. There are also some rare genetic diseases that can cause neuropathy. But for our purposes, and again, I said I'm not surprised that so many people have interest in this topic, because neuropathy affects up to 90% of cancer survivors, and treatment-induced neuropathy being the cause. The most common among people with cancer and people who've survived cancer is chemotherapy-induced neuropathy. There are some other types of neuropathy that we're not going to get deep into today, but the main one is chemotherapy. So why does this happen? So the problem is that the same toxic ingredients in chemotherapy that are used to kill cancer cells, they also damage the nerves of the hands and feet. Why is it the hands and feet? That has to do with how long the nerves have to travel from your spinal cord out to your hands, down to your feet. The longer they have to travel, the farther they have to go from your spinal cord, the more likely it is that they'll get damaged by chemotherapy. So since your feet and your hands are the farthest away from your spinal cord, those are the things that tend to be affected. And there are a number of chemotherapies that can do this, and a lot of them are pretty common chemotherapies. So the platinum chemotherapies, so things like cisplatin, oxaliplatin, carboplatin, taxane, so docetaxel, Taxol, which is also called paclitaxel, thalidomide, which isn't really common, but some people get, and then some other drugs called vinca alkaloids. It's also Velcade. So there are a number of chemotherapies that can do this, and some of them can do it at a pretty high rate. And unfortunately for many people, it's a matter of having to take the bad with the good, because without these medications, the cancer can't be treated, but the side effects can really affect people. There are three types of nerves that can be affected: sensory nerves, motor nerves, and autonomic nerves. Sensory nerves are the ones that affect your sense of feeling. So sensory peripheral neuropathy is the most common. So these are the ones that most commonly are affected by the chemotherapies. So what types of things do people experience? So tingling, burning, a buzzing electric feeling. People will also experience numbness. The symptoms will usually start in the toes and then later in the tips of the fingers, and then continue along the hands and feet towards the center of the body. And for everybody, it will be different as far as how much of their extremities is affected. So some people, it'll just be the tips of their toes. It'll just be the tips of their fingers. For other people, it may involve just the bottoms of their feet. For some people, it'll be up to their ankles or their calves or their knees. And in the hands, it can be just the fingers or the entire hand, or goes up the arms. But again, it affects these areas most commonly because those are the ones that are the farthest away from the spinal cord. Pain, unfortunately, is also one of the symptoms, and people will describe it a number of ways, and people's experience of it will be different. So people may experience a sensation of being pinched, or being stabbed, or burning sensation, or electric shocks. Anytime someone is describing these types of sensations to me, I know that we're dealing with neuropathy. People will also say that they have a tight feeling, like they're wearing tight gloves or tight stockings. And they'll say that they have difficulty feeling hot or cold, or knowing what temperature something is. People will say that they have difficulty knowing where their hands are or where their feet are in space. So some people have difficulty walking or picking things up because of this. And for many people, that gets worse in the dark, or when working with small objects. Working with small objects, that certainly makes sense. But in the dark, some people will have difficulty because if they don't know where their hands and feet are in space, and they can't visually see that, it can make it hard for them to be coordinated. And then another another common thing that people will tell me is that it's difficult for them to wear shoes, that they have to wear, open-toed sandals or flip-flops because the shoes are too uncomfortable. They're painful. And some people will also say, um, nothing can touch my feet. Nothing can touch my feet. I get into bed at night. I have to pull the covers up to my shins because if they touch my feet, it's just miserable. So sensory is the most common. Motor nerves. Motor nerves can also be affected by this. And the motor nerves are the ones that send information between your brain and your muscles. Motor nerves are the ones that your brain uses to tell your body what to do. And damage to motor nerves can cause a number of problems, even apart from whether there is a sensory issue with being able to tell where your hands are or your feet are in space. Damage to motor nerves can cause difficulty walking and moving. It can cause your arms or legs to feel heavy or weak, and can make it difficult to keep your balance or be coordinated. Can cause problems with everyday activities like texting or buttoning a shirt. It can also cause muscle cramps in your hands or feet. For some people, the muscles will actually get smaller. And I saw restless legs and feet at night as a comment there. Absolutely. Yeah, absolutely. Autonomic nerves, I'm just going to talk about briefly. This is less common, but I'm just going to mention it. So autonomic nerves are nerves that control body functions that you don't have to think about. These are nerves that you might not be as familiar with, but they're ones that that allow you to sweat normally, that regulate digestion. So if you have problems with your autonomic nerves, you may have difficulty with sweating normally. You may have difficulty with digestion, may have diarrhea or constipation, dizziness or lightheadedness, because autonomic nerves control your blood pressure. They also control your swallowing and urination. And some people also will have sexual problems because of damage to autonomic nerves. So when somebody is telling me that they're having sensory neuropathy, or they have a motor neuropathy, I have to wonder, are they also, or I have to think about, are they also having problems with their autonomic nerves? So this is a question that almost everyone asks and wants an answer to, and that is, how long do these symptoms last? What can I expect if I have peripheral neuropathy for the future? So about a third of people who develop peripheral neuropathy, when it's due to chemotherapy, it will go away entirely within a few months. That's about a third of people. A third of people will have residual symptoms that improve when they're done with their chemotherapy, but never go away. And then a third of people have residual symptoms that unfortunately don't improve. So you can see that a majority of people who develop peripheral neuropathy will have at least some degree of symptoms of that neuropathy that can last for a very long time, can even last for the rest of a person's life. So what can we do about it? How can we relieve some of the burden that peripheral neuropathy puts on us in our daily lives. So doctors love exercise, right? It really doesn't matter what kind of doctor you're talking to. They probably like exercise and they probably recommend it. I'm in that camp. So the big disclaimer, right, that you see every ad that you see on TV for like a Peloton bike or, or go to the, the big box gym, talk to your doctor before beginning any exercise program, right? So that disclaimer's out of the way. It's good to work with a trainer or a physical therapist. The reasons for doing this are you want to establish an exercise routine and you want to make sure that you're doing your movements correctly. That's especially important if you don't have a good sense of where your feet or your hands are in space, right? You want to make sure that you're doing everything correctly with the right form. And even if you do have a good sense of where your feet and your hands are in space, you don't want to be doing exercises wrong and end up hurting yourself more. So it's a very good idea to work with a trainer or a physical therapist. Using a stable environment is important. So neuropathy can affect people's balance. So you want to make sure that whatever environment you're using, wherever you're doing your exercise, you're not going to be falling down or dropping something. So, weightlifting machines, for example, would be better than using, dumbbells or free weights. The weightlifting machine, it's all contained. If you're doing say like a bench press, for example, there's just a bar that you press up and down. You don't have to worry that you're gonna tip one way too much or tip the other way too much, or God forbid, drop it on your chest. If you're doing aerobic exercise, a stationary bike would be better than a treadmill or an elliptical machine. Working on balance is important. So how do you work on balance? Doing things like standing on one foot while you're brushing your teeth, right? And then doing that, once you're good at that, doing that with your eyes closed. Being consistent. It's important to exercise at least 2 or 3 times a week, but don't overdo it. Depending on what kind of treatment you're getting or you've gotten, you might need more time to rest between exercise sessions than you would otherwise. As a general rule, you want to give yourself 48 to 72 hours, so 2 to 3 days between any resistance training sessions. And ultimately, the goal of exercise, in addition to all of the other all of the other positive benefits that it has for your health, is to help to maintain your functionality in your daily life, your ability to do things that you want and need to do, and to improve your symptoms. As far as intensity of exercise, what's the difference between moderate or vigorous exercise? You know that you're exercising with moderate intensity if your breathing quickens, but you're not out of breath. You have a light sweat after about 10 minutes, and you can talk, but you can't sing. Vigorous exercise, on the other hand, your breathing is deep and rapid. You start sweating after just a few minutes, and you can't say more than a few words without pausing for breath. So if you're on the stationary bike and you can carry on a full conversation with the person on the bike next to you, then at most that's probably moderate intensity. If you can't speak to the person on the bike next to you in more than a few words at a time, then that's vigorous. And So what, who cares? Well, the American Cancer Society and the American College of Sports Medicine recommend a pretty good amount of exercise. So they recommend 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. The American Cancer Society also recommends strength building exercises at least 2 days per week. So that's a fair amount of exercise. And I'll say that any amount of exercise is probably better than none. But to really get the most benefit out of it, 150 minutes of moderate intensity or 75 minutes of vigorous intensity per week with at least 2 days a week of strength building exercises. So here at MD Anderson Cooper, just so that you're aware, we actually have physical therapists who are specifically trained to work with cancer patients and can help people to put together a program that is going to be right for them, that will be individualized for them. So I would encourage anybody who isn't, who is dealing with neuropathy and who isn't already doing an exercise program to talk to your doctor about it and to ask them if meeting with a physical therapist to put together an exercise program would be right for you, which probably it would be, but it's definitely worth you looking into. So, what are other things that we can do to relieve peripheral neuropathy? A couple of non-medication things that some of my patients have done: acupuncture. So. I will say that I am afraid of needles. I am very bad with needles. Okay. I am not at all a good patient in that respect. The Red Cross asked me to stop coming back to try to donate blood because I am so bad with needles that that they said this just isn't for you. So with that said, right, I'm not a needle person. I've had acupuncture and not for neuropathy, for other things, and found it helpful and not certainly not the kind of experience I had with giving blood. Not everybody finds it helpful. Some people do. Look, none of these things does everyone find helpful, but these are things that people can try. So acupuncture is one. There are physicians actually at Cooper who do this. And another non-medication thing that some of my patients do is called TENS, which stands for transcutaneous electrical nerve stimulation. And the idea there is that it's a non-invasive intervention that's used for pain relief in a variety of conditions, including neuropathy. And what it involves is attaching electrodes to the skin, either at the site where there's pain or near nerves that are associated with the pain, and then administering a gentle electrical current. The data for this, frankly, isn't great. But in some studies, it's been shown to improve neuropathic symptoms associated with diabetes. So for chemotherapy-induced peripheral neuropathy, the studies aren't really there. For diabetic neuropathy, there is some evidence. Anecdotally, I would say it's probably about 50-50. About half of people, anecdotally, about half of people that try it find it helpful, and about half don't. What about medications? There are a number of medications that we can give for relieving the symptoms of peripheral neuropathy. And before I talk about the medications, just a reminder, right? Most medicines have more than one use. So think about Tylenol as an example, right? So I have taken Tylenol in the past when I had a headache. And I have taken Tylenol in the past when I had a fever. So is Tylenol a headache medicine or is it a fever medicine? It's both, right? It does more than one thing. And that's true for a lot of the medications that people take. So these are categories of medications that people will use for peripheral neuropathy. So over-the-counter pain medications, of course. Tylenol, Advil, Aleve, ibuprofen, etc. Over-the-counter pain relievers people use all the time. Among the most effective medications as a class for peripheral neuropathy are medications that were first marketed as antidepressants, right? Medications have more than one use. So medications that were first marketed as antidepressants. Nortriptyline is an example of one of those medications. It's an older medication. A newer medication in the antidepressant family that people will use is called duloxetine. The brand name for that is Cymbalta, and many people have heard of that because of advertising on television. And the way that the antidepressant medications work in peripheral neuropathy is that they increase your brain's ability to inhibit incoming pain signals. So they increase your brain's ability to tamp down the sensation of pain that's coming from the peripheral nerves to the brain. Duloxetine is also, for some types of neuropathy, is considered the treatment of choice. Another class of medications that people will prescribe for, that doctors will prescribe for peripheral neuropathy, are medications that were originally used as seizure medications. The way that they work is by quieting down or settling down the nerve endings, right? And this is why they work in epilepsy. In epilepsy, people have seizures because their nerves are overactive. So the medications for seizures help to settle those nerves down. It's the same idea with peripheral neuropathy, that certain seizure medications can help to settle that down. So common seizure medications that we'll prescribe for peripheral neuropathy include gabapentin and pregabalin. Gabapentin is also known as Neurontin, and pregabalin is also known as Lyrica. Lyrica is also one that there have been a lot of ads on TV for. As far as how effective gabapentin is versus Lyrica, which is the one that you see on TV, there isn't much difference as far as how effective they are. It's the difference between the two is really and every person's body is different, kind of thing. So for most people, gabapentin works fairly well. If someone takes gabapentin and that doesn't work for them, then we'll switch to Lyrica. Why don't we do it the other way around? Why don't we do pregabalin or Lyrica first and then gabapentin? Honestly, that has to do mostly with insurance coverage and cost. So if you have two medications and you have no good reason to prescribe one over the other, right? If the effect that they have is basically equal, then it usually makes sense to prescribe the one that's going to be covered by the person's insurance. and that's not going to cost them as much. So that's why we usually prescribe gabapentin first. There are other medications, other seizure type of medications that we'll prescribe, like topiramate. I don't prescribe those quite as often, but um, they are available to use if needed. Local anesthetics, so topical medications, things like lidocaine patches, for example. The way that they work is that they block nerve conduction, and so they block the pain signal from getting from the from the hand or the foot up to the spinal cord and up to the brain where you feel it. They're very nice in that they it's not something that you have to remember to to take 2 or 3 times a day. It's not something that is circulating all around your body, right? Because when you take a pill, it doesn't just go to the spot where if it's a pain pill, it doesn't just go to the spot where you're having pain. It goes all over your body. Whereas with a topical patch, you can just put the medication right in the place where it's needed and not have it, circulating all over. The problem with topical medications is that if there's a large area where there's pain, they're not very practical. Or if there's a bunch of small areas, like it wouldn't be very practical to put lidocaine patch covering all of your fingers or all of your toes. Another topical medication that I'll just mention is capsaicin. That's a substance that's actually found in hot peppers, and can desensitize peripheral pain nerve endings. You can get it over the counter. Got to use some caution with capsaicin though, because it is very hot, and it can be painful when you initially put it on. You also have to be careful where you get it. So, and which is to say, what areas of your body you get it onto. So you would not want it touching any of your mucous membranes, right? You definitely wouldn't want it in your mouth. You definitely wouldn't want to accidentally rub it in your eye. So capsaicin has to be used with caution. Many people find it helpful, but got to use it with caution. And then I also want to mention medicinal cannabis. I have many patients who use medical marijuana who are in the New Jersey medical marijuana program. The evidence for medicinal cannabis in treating painful peripheral neuropathy, the evidence isn't great. Anecdotally, what many of my patients tell me is that it helps with pain. The way that it helps with pain is by helping with the anxiety that the pain causes, right? So there's the physical aspect of pain where you have the physical sensation of pain, and then there's the emotional aspect of pain that the physical sensation causes, right? So the physical sensation, if you can treat the emotional part, if you can treat the anxiety that it causes, the physical sensation can be more bearable. So what many people will tell me is that when they use medical marijuana, if they're using like gummies or lozenges or taking it by mouth in some way, it'll help them to relax so that they may still have the pain, but they can kind of sit back and observe it and say, yeah, it's there, but I'm okay. Another way that people will use medicinal cannabis is topically. So there are some topical preparations of medical marijuana that you can get at medical marijuana dispensaries. Those are I would say those are hit or miss. Some people find them very helpful. and others don't. Again, the scientific evidence for it is not great, but some people find it helpful and others don't. So, what are some other ways that that we can relieve the pain of peripheral neuropathy? So there, for a lot of people, there is a role for interventional pain management. So injections are something that that people will get. Uh, these are generally done by anesthesiologists under X-ray guidance, and the injections are directed specifically at the nerves that are involved in the pain, and the sensory nerves that are involved in the pain. What I've seen, so the data for this is very good, right? And from what I've seen, a lot of people have found these very helpful. And there are a number of different types of injections that that they can do. They can give epidural steroids, lidocaine, bupivacaine, and there are other things that they can do to the nerve fibers to decrease the amount of pain that people are experiencing. And in some cases, people are able to get pain relief that can last for months without having to have any additional medication, which is fantastic. For more severe cases, the interventional pain management folks will give people spinal cord stimulators, where a small electrical current will block the pain signals. And then there are also cases where they will do an implanted medication pump that puts a small amount of medication into the spinal cord that kind of bathes the nerves in medication and decreases the pain that way. And then opioids. So when I can, I try to avoid prescribing opioids for patients with neuropathy. But sometimes the pain is very severe, and that's what we have to do. We all know what the what some of the issues with opioids are, including dependence and addiction, among other among the other side effects that you can get from taking opioids, especially over long periods of time. One of the newer drugs that that we use that's in the opioid family is called tapentadol. The brand name for that is Nucynta. And I've had some success with this with some of my patients. The nice thing about tapentadol is it's not a strong opioid like morphine or hydromorphone or fentanyl. So it's not as strong as those. And in addition to the opioid activity, it also is a what's called a norepinephrine reuptake inhibitor, which puts it in a similar class to some of the antidepressant medications. So it combines, tapentadol combines the activity or the effectiveness of an opioid medication with one of the antidepressant medications. So it can be good for neuropathic pain because it does those two things together. Okay. All right. I apologize. I have something odd going on here with my screen. Okay. There we go. Okay. So research. So what is the, what's coming as far as neuropathy? These are a few examples of things that are being investigated. So one is neurofeedback. Neurofeedback is it's a type of biofeedback. I don't know if anybody's ever done biofeedback. I did it a very long time ago for some chronic pain. But the idea is that this is biofeedback where they use EEG sensors that are put on your scalp to help track brain waves in the areas of your brain that are active during neuropathy pain episodes. So what you do is you have these electrodes attached and you see your brainwave patterns on a video monitor, and you can learn to alter those brainwave patterns and kind of reset the brain to self-correct during pain episodes. So it's biofeedback plus a brainwave video that you watch and you learn to control. Much like you would when with meditation. Scrambler therapy. So scrambler therapy, the idea is that they use a machine to try to block the transmission of pain signals by providing non-pain information to the nerve fibers that have been getting the pain messages. So they attach 5 electrodes, and they send electricity through the electrodes. And the idea is to, kind of confuse and remodulate the nerves so that they aren't sending the pain signals all the time. This is something that has been, that they've been using in Europe for a while. It's newer in the United States. At this point, and I should say, at this point, none of these is something that insurance is going to cover, and these are not things that that are widely available. But this is just for your information about the future. And then repetitive transcranial magnetic stimulation. It's also called RTMS. And with that, they use magnetic fields to generate electrical currents. Magnets are used to create electricity in general. And the idea is that they can alter the pain processing in the brain by doing this. The quality of evidence for, the quality of scientific evidence for these at this point, for none of them is it particularly good. But as I said, these are also areas of ongoing research. So staying safe by avoiding injury. This is really important when you have neuropathy, because you are going to be more prone to injury, and so there's some things that you should do to keep yourself safe. One is wear shoes, assuming that that wearing shoes doesn't make your pain worse. Wear shoes and look at your feet every night. This is important because if you injure your foot, you may not know it if you're in pain all the time. You may not know it if you have numbness in your feet, and it can get infected. One of the classic thing around this time of year, well, almost, we're coming to that time of year, is somebody goes down the shore and they have neuropathy. They're walking on the beach. They step on a seashell It cuts their foot, gets into their foot, gets stuck in their foot, but they don't realize it. And so, a few days later, they've got blood in their shoe. They look at their foot. They've got a seashell in their foot. Now it's infected. Can turn into a very bad infection. So just keep this in mind. And please, if you have neuropathy, it's a good idea to look at the bottoms of your feet every night. Be careful with sharp utensils. If you're having difficulty with where your hands are in space, it can be easy if you're cutting up the onions. It can be easy to miss. And if the sensation in your fingers, if the sensation in your hands is not normal, you may not even realize that you have cut yourself. And dangerous machinery, so don't be playing with the bread slicer, obviously. And hot water. Check with another part of your body first, right? So assuming that your wrist isn't affected, you can use the inside of your wrist to check temperature. And this would be really important if you're taking care of a young child, one of your kids or grandkids. It's always important with young kids to check the temperature of water beforehand, but I guess baby yourself in that way. Definitely avoid heating pads and hot water bottles where you may not even realize how hot the thing is until you've been injured. I missed that, Roxanne. I missed that comment there.
One of the ones which I was going to ask you at the end.
Okay. Yeah.
They were talking about 2 different over-the-counter medications. I'm keeping track of it, so go ahead and finish, and then we have your questions after.
Oh yeah. Okay. Sounds good. All right. We're getting close to the end. So, other advice for people who are experiencing neuropathy. So you're going to be more prone to falls because of difficulty feeling the ground beneath you, especially in dark and closed spaces. So it's a good idea to use a nightlight to keep clutter and throw rugs off the floor, things that you could trip on. Use the handrails when using the stairs, and it's a good idea to put handrails in the shower also. Make sure that you use skid-free.
Go ahead.
Pardon? Use skid-free shower and bath mats, and moisturize. You want to make sure that the integrity of your skin is good, and you don't have a lot of cracking skin. So just some closing thoughts. Peripheral neuropathy is very common among cancer survivors. As I said, up to 90% of people who are dealing with cancer will experience neuropathy at some point. A third of those folks, it will go away entirely when they have finished their chemotherapy or shortly after. A third of those folks, the symptoms will improve but never really go away. And a third of those folks, the symptoms just stay the same over time. So it's very common. Your doctor can recommend things that can relieve the symptoms of peripheral neuropathy. Some of those are medications. Some of them aren't. As I said before, I'm a big advocate for exercise, like most doctors are. And it's important to think about safety and to make sure that that your environment is safe, and that that you're also checking your feet and checking the temperature of things before you put your hands and feet into them. So That was that was my last slide. And Roxanne, you said that there were a couple of questions, so I would love to I'd love to
So,
answer those now.
um, Carla had asked about, is it considered neuropathy if I have pins and needles and feeling like my hand is asleep? And also, she said that she used cold pack with her chemotherapy treatment for Taxol. And she was wondering why she still has those pins and needle finger, um, pins and needle feelings in her hand.
Yeah, yeah. So uh that sounds like probably it's neuropathy. Without knowing more about the specifics of the timing and exactly what's affected and other symptoms, you know I couldn't say absolutely for sure, but that sounds like probably it's neuropathy. And some people will use cold packs to try to prevent neuropathy. The more common one that I've seen is people using cold packs to try to prevent hair loss from chemotherapy. Um, I don't think that you know, from what I've seen, uh, uh, the 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 data, the scientific data for the effectiveness of that isn't very good. Um, I think it's one of those things that people want to try sometimes, and I think that's great. But unfortunately, even uh, no no matter what we do, it often just is not avoidable. It often is just not avoidable.
So, Dr. Hardy,
Yeah.
I have another question that says that I can assume that after 2 years, the neuropathy will not resolve. Can you address that, or are there anything that can help people that have had neuropathy for a while?
Yeah. Absolutely. So, um, I think that uh, you know, like I said, this is a pretty common problem. And you know, if you've had neuropathy, if somebody's had neuropathy for 2 years, then probably that's going to persist. Um, you know, as far as what we can do about it, the things that some of the things that I mentioned in the presentation, I think are would be a good idea. Um, an exercise program for strength and balance, um, medications to help with pain, um, maybe seeing an interventional pain specialist. Um, and uh, I think that seeing somebody that specializes in neuropathy to talk about what interventions or what modalities of treatment could be helpful would be a good idea, especially after 2 years.
Um, Dr. Hardy, are there specific physicians that treat neuropathy? Like, could they get an appointment with you,
Yeah,
or?
absolutely. So, yeah, so I do treat neuropathy. Um, there's some overlap among specialties, and it's uh, in a lot of ways it's a multidisciplinary treating neuropathy is a multidisciplinary thing. So there are people like me. I'm a palliative medicine physician. There are interventional pain specialists, and there are physical medicine and rehabilitation specialists who can help with physical therapy and who can do things like acupuncture. Um, and there are also neurologists who can help to evaluate, especially in cases where we're not 100% sure, uh, you know, what the cause of the neuropathy is. So if there's any question about whether it's chemotherapy or something else, um, there are a number of specialists who can deal with that. I would say that if you're dealing with chemotherapy-induced or treatment-induced peripheral neuropathy, the place to start would be with your oncologist, and to ask them for you in your case, what should your next step be? Who should you be going to see, and who should you be talking to?
Is it common not to have symptoms or problems during chemo, but develop them months or years later?
That's a great question. Uh, it certainly happens. And that would be, I'll say that would be the kind of case where I might have somebody see a neurologist, or I might want to do some other testing. I certainly have seen that happen, where people will not have will not have neuropathy during their treatment, and then afterwards they develop it. I think that happens because the the chemotherapy treatments are cumulative, so it can take a while for the effects of the treatment to catch up with people, and some of you may have had this kind of experience where the first treatment isn't so bad, and then the next treatment isn't so bad, and then the third treatment there's some more side effects, and then the fourth treatment there are more side effects, and then it builds. Um, that can be true with neuropathy as well, and for some people it can be that they stop treatment and the neuropathy hasn't started yet, but then can build for months afterwards. But again, in those kinds of cases, which are a little less typical, that would be where we would probably want to do some more testing, and maybe have somebody see a neurologist.
Dr. Hardy, I had several people that mentioned some supplements, the alpha lipoic acid,
Hmm.
B complex.
Yep.
There was one person that mentioned uh, Podiapin.
Hmm.
Um, are those good supplements, and how do you know which supplements are good to treat the neuropathy?
Yeah, no, that's a really good question. So yeah, a lot of people will use those supplements, and many people find them helpful. It's unlikely that they're harmful. Um, for some people, there is also a nutritional component to neuropathy. Um, uh, I think that uh, I haven't seen any of those be a home run for anyone. Um, but I think that the ones that you mentioned, I have seen help people and are worth trying. Some people do need, when there's a concern that there may be a dietary component or a nutritional component to their neuropathy, then we'll test for things like vitamin B12 deficiency, which these days is pretty rare. Um, but too much vitamin B12 it's hard to have too much vitamin B12. It's not the kind of thing that has a lot of toxicity.
Um, what about what was that? Infrared treatment? Have you heard any information about infrared treatment?
I don't know very much about infrared treatment. Uh, I guess we're talking about heat, because infrared is heat. Uh, what I would say about heat is what I said before, like about the heating pads and hot water bottles. Uh, if you find it helpful for your pain, okay, just make sure that you test the temperature on a more sensitive part of your body where you can really feel what the real temperature is, because it's easy to accidentally burn or freeze yourself if your nerve endings aren't working the way that they normally would. Um, So I would say, with infrared, it may help your symptoms, but use cautiously. Make sure that you don't accidentally burn yourself.
I know we're over a little bit and we have a lot of questions.
Okay.
Dr. Hardy, do you mind staying on for a few more minutes?
No, that's fine.
Okay. I'm going to, somebody had asked about where to buy comfortable shoes. I will try to find out information
Okay.
on that.
Uh-huh.
But I'm going to unmute and we'll take maybe another 5-10 minutes. If you have a question for the doctor, I'll unmute you and you can unmute yourself and ask the doctor a question, okay? Anybody have a question for Dr. Hardy?
Yes, I do. Dan Sweeney. I guess I'd consider myself lucky. It's been 3 years since I've had chemotherapy, and it hasn't gotten any better at all. But I'm lucky in a way that I have no burning or no pain at all. It's just numbness in my feet. When I try to
Yeah.
walk fast, I feel like my feet are flop, flop, flop like that. And
Yeah.
so that's what I'm kind of working on. Most of the stuff I hear is, for pain relief. So I'm lucky in the way that I don't have that. A little restless at night, but that's all.
Yeah. 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 Uh, the numbness part is that's difficult to treat, honestly. I'm glad to hear that you aren't dealing with pain. That's a blessing. But
Yes.
the numbness is really difficult. There aren't really any good, I'm sorry to say, there aren't really any good treatments for the numbness. The medications that we have, they really treat the pain. Um, the the damage that happens to the nerves, there aren't medications that fix that damage, so there aren't medications that can bring back the sensation. The medications that we do have and other interventions that we do have are ones that can decrease uh, the feeling of pain. If you're dealing with numbness in your feet, though, um, it's I would say it's all that much more important that you practice good safety, um, that um, that you make sure that you are working on your balance, that that you have things like a night light, and so you're not trying to walk around in the dark, that there isn't a lot of clutter around that you might trip on. Um, but other than that, unfortunately, there aren't really good treatments for that. I'm
Well,
sorry to
I,
say.
I
Yeah,
drive straighter than I walk.
yeah. What was that?
I said I drive straighter than I walk.
You drive straighter than you walk. Yeah.
Yeah.
Yeah. All right. Well,
But like I say, I'm lucky the chemo knocked out the cancer, and
yeah,
and these are just kind of bumps in the road, considering everything.
yeah, yeah. Yeah, like I said before, it's unfortunately it's one of those things where you have to take a little bit of the bad with the good, but
Sure.
um, yeah, I definitely would suggest some talking to your doctor about some physical therapy and just making sure that your physical environment is safe for you. And
Right.
uh,
Well, thank you.
yeah, yeah, absolutely. God bless you. Thank you for your question.
Question?
Do we have any more questions?
I
for
have
the
a
doctor?
question.
Go ahead.
I had vinca alkaloids for non-Hodgkin lymphoma twice, 2 stage 4s. I never got neuropathy till a year later, and it's really cramping, terrible nighttime cramps, and twitching of my calf muscles, and cramping in my feet. Is that a form of neuropathy?
It very well could be. I mean, the symptoms that you're describing are symptoms that are, are consistent with neuropathy. Um, I would say that, a year out from all that treatment, it would be unusual, but not unheard of. And that would be yours would be a case where I'm sure that we would want to do more testing to make sure that there wasn't something else that was going on. But yeah, it absolutely could be neuropathy. Um, and if you still see your oncologist, they definitely should know about this. Um, so I don't know if
I
you,
saw a I go to University of Pennsylvania for the
uh-huh,
lymphoma,
uh-huh,
and I saw a pen neurologist and had many tests done
yeah,
about after my first rounds of stage 4 lymphoma,
yeah,
and they did not. Nothing came up questionable.
okay,
They couldn't figure out what was wrong. I also have a lot of dehydration problems
yeah,
since chemo, where I can't drink any alcohol because I have syncope.
oh,
Uh, I talked to my oncologist at Penn, and he said we are just cannot figure it. Everybody has different symptoms from chemotherapy,
yeah,
and we haven't come up with any conclusions for any of it yet, I guess, is what I got.
yeah, yeah. I'm I'm sorry you're dealing with that. And it's frustrating to not have answers. Um, I'm sure that the workup that they did was very thorough. I don't know if it's still ongoing or if it's done at this point. But I mean what you're describing absolutely like I said is consistent with neuropathy that may be from your chemotherapy. Um, I, uh, I do hope that they get an answer for you though. That must be very frustrating.
Yeah, I'm taking, I went Elavil, which is amitriptyline.
Yep.
They had prescribed and told me to titrate it up, but I only went to 20 milligrams, and I stopped titrating.
Mhm.
They say that can help. Of course, you had mentioned that antidepressants can help.
Yeah, yeah. And there are
Yeah.
other antidepressants that can help as well. Um, uh, you know, uh, if you find that the Elavil isn't working for you, or if uh, you don't like it for whatever reason,
Mm-hmm.
it's worth asking them if there's a different one that you could try.
Okay.
But like I said, duloxetine for many people is the treatment of choice, so that might be worth asking about.
Okay. And the dehydration, could that be correlated with my muscle cramps? The fact that I get
Yeah,
dehydrated, I have to drink so much water.
yeah,
And during chemo this last time when I was at Penn, I had gotten that CAR T cell treatment.
right.
But during the chemo, my hands were cramping up terrible. I could hardly hold a glass. And the doctor
Yeah,
said my oncologist said to mix Gatorade with water because of you're losing a lot of your electrolytes.
electrolytes. Yeah, I was
Is
about to say, yeah.
that also a side effect of chemotherapy?
Um, yeah, I should say I'm not an oncologist, but uh, yeah, dehydration absolutely can cause muscle cramping, and then you mentioned electrolytes. That would be the other thing which you can lose a lot of if you're urinating a lot. So um, uh, it a lot of times it's not just one thing also, right?
Yeah,
Sometimes it is
yeah.
just one thing that's causing a symptom, but sometimes it's not. It might be a combination of peripheral neuropathy with dehydration
Yes.
or electrolyte
And muscle
problems.
twitching, doctor, is that part of um, the cramp, the muscle
I
twitching?
I have seen muscle twitching neuropathy. Yes.
Yeah. Okay. Thank you. I
You're
appreciate
welcome.
your
You're welcome. Take care. Thank you so
comment.
much for your question.
Okay.
I have a question.
Mhm.
unfortunately, I got diagnosed with neuropathy last year and then cancer this year.
Oh,
So,
oh goodness.
so
Okay.
yeah, so I wear the cold cap and I wear the gloves and the booties with the ice. I am getting some more tingling in my fingers than I had before. Before it was only in my left foot. But I have two questions. Sertraline, which I just started taking, since that's an antidepressant, should have a similar effect on the neuropathy?
So sertraline, uh, I've prescribed sertraline for neuropathy before, and I've seen it be helpful.
Okay.
So it may very well help with your neuropathy. And I'm sorry, I missed it. You were prescribed it for the neuropathy, or you were prescribed the sertraline for something different?
For anxiety,
For
yes. With
anxiety.
dealing with the diagnosis, yes.
Yeah.
And yeah, because I was thinking, if there's something better out there, I can ask to be switched off to take something else if it'll deal with my tingling as well. You know what I'm saying?
Yeah. Yeah, absolutely.
And
So
they also recommended that I took CoQ10. When I saw my neurologist last year, they said that was a good vitamin. I
yeah.
don't know if you've told people that in the past, but
Uh, yeah, absolutely. CoQ10, uh, again, is one of those things that some people find helpful, some people don't, and probably can't hurt.
right. Okay. All right. That's all I had. Thank you very much. I appreciate your time.
Oh, absolutely. Thank you for your question, and thanks for being here today.